On behalf of the Minister, I warmly welcome all of you to this press conference and thank you for honoring our invitation at providing clarity, updates, and important information on matters concerning our recent recruitment. We appreciate the critical role the media plays in informing the public and ensuring transparency and accountability in governance. It is therefore important that we continue to engage you openly and constructively on issues of national interest. This press conference is aimed at addressing key development, ongoing interventions in the recruitment regime of the Ministry of Health. The Ministry of Health wishes to update you on the general public and the general public on the ongoing recruitment process of health professionals that took place across the country recently. To give you the background, in April this year, the Ministry of Health received financial clearance to recruit about 8,000 health professionals from the Ministry of Finance. The Ministry acknowledges the anxiety and interest this recruitment exercise has generated, particularly given the backlog of about 105,000 unemployed health professionals, ranging from some having their last recruitment in 2019, some 2018, and particularly for nurses was 2020 batches. This, I must say, is heavily guided by the objectives of free primary healthcare policy, with emphasis on strengthening preventive care, community-based care, and primary health care delivery, particularly in underserved areas of the country. These objectives, guided by the human resource policies and operational documents of the ministry and its agencies, such as Ghana Health Service, CHAG, Ahmadiyya Health Services, and Mental Health Authority, were used to determine the allocations by professions and by locations. With that, I'm saying that by locations, that we are talking about the districts that we considered in this recruitment process. In the interest of transparency, regional locations were based on staffing norms and annual human resource requirements submitted by these agencies. Consequently, regions and districts with greater staffing gaps and healthcare needs and professions with a high impact on the sources of free primary healthcare policy received the highest allocations. I must say that all regions received some allocations, but not all metropolitan, municipal, and district assemblies were considered. For the Accra region, it's only Adan West, Adan East, and Ningo Pram municipality that were prioritized, though other districts also got some little of these numbers, but most of the numbers went to these three districts in the region. Based on the submissions from the relevant agencies, most professional groups were also considered. However, those with a higher impact on the success of free primary healthcare policy received allocations. So traditionally, when we are doing recruitment at the health sector, you realize that we concentrate more on the registered general nurses, concentrate more on the midwives. We don't usually concentrate more on the certificates and other cases. But in this instance, nurse assistant preventive and registered public health nurses were prioritized in this category of nurses. Those two professions got about 40% of the 6,500 allocated to nurses. The reason being that the emphasis at this point in time is on the free primary health care. And then you are going to start with the home care and home visits. So these are the priorities that we use to do the allocations this time. And to support direct district level recruitment, the ministry introduced a new recruitment portal. This portal basically decentralizes the allocation to the districts. So today that we are done with the process, all of the people that have actually submitted the applications, it will fall directly to the district, and the district that will call them. The Ministry of Health will not have any role to play again. it was this that will call them, they'll go to the district for their interviews. I must say that the feedback on the system has been taken into account, and then we will use it to improve user experience going forward. This platform successfully ingested about a substantial baseline of records of about 53,440 health professionals. I don't know whether you remember that we give 1 week for health professionals to go onto the portal to verify their data. We got about 53,440 health professionals that went to the portal. Allied health professionals, those that we have on the portal currently, they are about 30,226. And this spans from professionals who qualify to work with the Ministry of Health from 2019 to 2024. Nurses and midwives, we prioritize only 2021 batch, and their number is 16,860. Physician assistants, they also are from 2018 to 2024, and they are 4,631. Pharmacists, 2,975. And then pharmacy technicians, 1,778. With CRAs, we had about 5 of them also patched. 29,893 total accounts were initiated, with 2,636 without profile creation. So when we analyze the portal, we read about 29,893 accounts were created, but out of that, 2,636 were unable to create their profile. The rest of them all created their profiles. The top cadres with active accounts on the portal currently include registered general nurses, 4,158, registered midwives, 3,503, nurse assistant clinical, 1,329, nurse assistant preventive, 2,724, registered public health nurses, 960, nursing officer, 804, medical lab sciences, 2,058, medical lab technicians, 1,546, physician assistant, 901, pharmacy technicians, 720, and nutritionists, 1,217. These are 3 of the sections, the days that we had the highest traffic. With 5 minutes, how many numbers you receive on the traffic? Greater Accra and Eastern Region, 217 applications were submitted within 5 minutes. Ashanti Region and Bono Regions, 153 applications within 5 minutes. And Central Region and Western, 123 applications within 5 minutes. This gives information why when you were recruiting at the northern part of the country, you were not having much problem, but when we started coming downwards, we were having these challenges. The top applicant group that we were recorded on the platform are the registered general nurses group, represent the highest number of applications nationwide, recording 4,158 applications. Then for the first time, the highest localized demand. For the first time, a district in the northern part of the country, West Mamprusi, recorded the highest total number of successful applications, with over 90 successful applications. So the objective of us to create this platform is for us to do redistribution of health professionals. Previously, after the recruitment process, you see people trooping and asking for change to work in the cities. But this time, you made it that when you apply, it goes directly to the district. And when you look at the platform, West Mamprusi had the highest numbers. And this also informed the ministry deliberate effort to allocate more professionals to the rural areas and the deprived areas. The total self-application at the end of the main application process comprised nurses and midwives, a total of 6,245 applications out of the 6,500. The remaining is allocated to some critical areas of the teaching hospitals. I think if you all observe, the teaching hospitals were not on the platform. They were not having slot on the platform at this process. We intentionally did that so that people doesn't keep the TTs only. And the teaching hospital and the specialized services delivery, just such as the psychiatric hospitals. So you get opportunity for those ones also to be filled. Allied health professional, a total of 771 applications have been successfully submitted out of the 900. The remaining is allocated to some critical areas of the teaching hospital and specialized services that will also be opening soon. Pharmacy and pharmacy technician, 235 successful applications were submitted out of the 250. And the physician assistants, all their vacancies were taken. The CRAs, certified registered anesthetists, their vacancies, none of it have been taken. There are about 5 vacancies on the platform currently. So as I said, we currently have available about 87 slots on the platform, which include more of the public health nurses and the CRAs. These vacancies are mainly scattered within the northern district of the country. We are therefore working with the Ghana Air Service and CHAG and other agencies that brought the needs and then the gaps so that we can either reallocate these cadres to different cadres. But then I must say that for the district that these allocations were done will never be changed. In the weeks to come, the areas of teaching hospitals and other specialized institutions such as psychiatric hospitals will also be considered as part of the MOPAP exercise. Also, ladies and gentlemen, I want to also talk a little about the issue of fraud and illegal collections. Considering the number of health professionals who are eligible to be employed and at home, this was actually expected and was part of the ministry planning towards this process from the beginning. We actually discussed that one at length. We had meetings with the security agencies before the process actually started and collaborated with them throughout the process. Through this collaboration, the support of the public, some unscrupulous persons are being investigated by the security agencies. We will communicate to the public when new developments in this regard are received from the state agencies. I might also say that we caution the leadership of the professional group to warn their members not to avail themselves to some of these corrupt individuals. And once again, I would like to use this opportunity to reach that call that whenever we start this process, we should not avail themselves because they will take your money and they will not be able to do anything for you. The resume for Kwabena Minta Akando has expressly stated on various platforms, we expect to receive further clearance from the Ministry of Finance for the recruitment of health professionals before the end of the year. The Ministry will continue to engage with the Ministry of Finance to secure this clearance for the benefit of our professionals at home. The recruitment portal will be reopened as soon as additional clearance is granted. I must also want to use this opportunity to inform the public that in the weeks to come, the Ministry will also start the process towards the recruitment of medical officers to fill open vacancies across the country, especially in the rural and deprived areas of the country. And then you also start the process of the volunteer recruitment that the Minister has also been talking about. So you also start that process. The volunteer recruitment will involve most of the health professional, but basically you look at the nurse assistant preventive first, and then you look at other assistants that will help. These volunteers will be given some stipends, and then they will also be considered, they will be given some priority when we are going to do the nurse recruitment. This year, the recruitment of volunteers will cover over 6,000 prospective professionals who completed school from 2022 to date. So the 2021 batch that we are currently recruiting will not be part. The ones that we receive currently, we know for the nurses, we concentrate only on 2021 batch. And then we have recruited some, you are waiting to recruit the others, so they will not be part of the voluntary process. Recruitment opportunities for all categories of health professionals as demonstrated in the current process. Quality high care delivery in health sector I think all of you know that depends on effective teamwork across all professional cadres. Our agenda, spearheaded by the vision of our minister, to ensure that underserved districts are adequately served with the requisite health professionals, is on course. And together with your support, we shall achieve this objective, which is very critical for the achievement of the country's UAC and SDG targets. Thank you very much.